Can you believe it? Even when hospitals have to shake their heads and give up, chronic back pain in the elderly can still be completely cured naturally and safely. If you are struggling day after day with persistent back pain that makes every step feel heavier, then take a moment to pause right here. Because in today's video, I am going to reveal to you some scientifically based methods combined with natural remedies, things that most hospitals never tell you. Before we dive in, leave a comment below with a positive affirmation as a commitment to attract good things into your life. Something like, "I deserve to have a healthy body," or any other wish you may have, and do not forget to subscribe to the channel so you do not miss out on any amazing content like this. Let's create a space full of positive energy where we can grow and succeed together. Have you ever wondered, why is it that despite all the advancements of modern medicine, chronic back pain remains an endless nightmare for millions of older adults? The truth is, most modern medical treatments only scratch the surface. They focus on easing pain for the moment, controlling inflammation, or dealing with visible damage found in magnetic resonance, imaging or computed tomography scans like herniated discs, bone spurs, slipped vertebrae, or narrowing of the spinal canal. Common approaches like steroid injections, painkillers, or surgeries to remove damaged tissue are really just about treating the symptoms. They never truly address the root cause of the problem. That is why there are so many people who, even after undergoing surgery, taking all their medications, and going to regular follow-up visits, still suffer from lingering back pain. It might ease for a little while, but eventually creeps back in, sometimes even worse than before. In many cases, hospitals can only shake their heads and tell patients they must learn to live with it. This is not because modern medicine is ineffective, but because the current approach does not dive deep into the body's entire operating system. The real nature of chronic back pain does not lie only in the 4th and 5th lumbar vertebrae or in a herniated disc. Those are simply the final symptoms of a long-term imbalance in the musculoskeletal system, including misalignment of the spine, instability in the pelvis, and weakness in the supporting muscle groups, all of which silently break down the body's natural force distribution system. When the body's axis becomes even slightly misaligned, the entire system from the shoulders back, hips, knees down to the feet must constantly bear abnormal loads every day. At first, you might just feel a slight soreness or dull pain, but over time, this imbalance accumulates into real physical damage, herniations, bone spurs, and degeneration. If you only treat the site of injury without rebalancing the body's axis, the pain will inevitably return, trapping you in a vicious cycle. This is why chronic back pain is a system-wide problem, not just a single localized injury. And this is also why simple solutions like medication surgery or short-term physical therapy usually cannot completely resolve it. Understanding why modern medicine often falls short is just the first step. Now it is time to take action. Starting with the most important foundation, restoring the body's natural balance with two key elements, the pelvis and the lumbar curve. To truly heal chronic back pain at its root, the first thing you need to do is not to take more medication, nor to perform more complex exercises. The key lies in restoring the body's natural mechanical balance, beginning with the most critical area, the pelvis and lower back. Imagine your body as a sturdy suspension bridge. If the bridge's cables are pulled too tight, the structure weakens. Pressure builds up at certain points, and the risk of collapse increases. Similarly, in the body, when the pelvis is tilted excessively or misaligned, the entire lumbar spine above it gets pulled and compressed. The spaces between vertebrae narrow, creating continuous pressure on the nerves running through them. The result is pain, numbness, muscle, weakness, symptoms that grow worse over time. Lowering the pelvis back to its natural position is not just a simple mechanical adjustment. It is the key to unlocking the spaces between the vertebrae, allowing nerves to decompress, blood vessels to circulate freely, and the body to kickstart its natural healing process from within. When the pelvis is properly realigned, the natural curve of the lower back, a gentle C-shaped curve, also gradually returns. This curve is essential not only for evenly distributing force across the spine when standing, sitting, and moving, but also for acting as a natural shock absorber, protecting the vertebrae from accumulated pressure. Many people mistakenly believe that back pain is caused by weak muscles or simply aging. But the truth is, it is the long-term mechanical misalignment that silently causes your back to hurt endlessly. Only when the pelvis returns to its balanced position and the lower back regains its natural curve can the true healing process begin deeply sustainably, and not just through temporary episodes of pain relief. Once you have a clear understanding of the foundation for recovery, the next question is, how can you practice on your own right at home, just a little each day, yet accumulate major results over time? Here are 3 simple, safe, and incredibly effective methods. 1. Manual pelvic dropping technique. To perform this technique, simply use your thumbs and index fingers from both hands to locate your iliac crest, the part of your hip bones that sticks out on each side when you place your hands on your waist. This is the topmost part of the pelvis where you will feel the most movement when applying gentle pressure. Once you have found the iliac crest, gently position your thumb and index finger as if you were lightly pinching a thin coin. Then, either standing upright in a relaxed posture or sitting firmly on a sturdy chair, begin to gently pull the iliac crest downward with moderate force. The key point is this. As you pull down, you should also gently extend your spine upward, as if you are creating a subtle amount of space between each of your lower back vertebrae. You do not need to pull hard or tense up. The correct feeling should be a soft, natural elongation, as if a slack rope is being gently loosened. During the practice, pay close attention to the sensations. If done correctly, you will feel a gradual lightness emerging in your lower back, as if long accumulated pressure is slowly being released. Some people even describe a sensation of gentle airflow traveling from the hips up through the back. You can perform this technique 2 to 3 times a day, each time gently pulling for about 30 to 60 seconds, depending on your body's tolerance. It is especially effective before and after periods of prolonged sitting, standing, or heavy movement. Practicing this technique consistently will help reduce pressure on the lumbar vertebrae, improve blood circulation, relieve nerve compression, and support the body's natural healing process, reducing back pain naturally without needing medication or surgical interventions. Remember, the effectiveness comes not from pulling harder or doing too much, but from gentle, persistent practice every day, like patiently undoing years of tightly knotted tension within your body. 2. Lumbar curve restoration. Exercise after learning how to lower your pelvis. The next step in the journey to healing chronic back pain is to restore the natural curvature of the lower back. This is one of the core elements that determines the durability and load-bearing capacity of the entire spine. To begin, choose a sturdy chair. Sit up straight with both feet firmly on the ground and knees slightly apart. Keep your spine naturally elongated, imagining an invisible string lifting the crown of your head upward, aligning your neck, back, and hips in a soft, tension-free line. Once you are settled, gently arch your lower back backward, creating a slight curve in the lumbar region. You do not need to force it. Just feel the natural curve returning to the spine after months or years of compression from poor posture. After maintaining this gentle arch, interlace your fingers and extend your hands upward, palms facing the ceiling. Imagine you are reaching for a bell hanging high above you, stretching your entire body upward. Once you feel the stretch traveling along your spine, gently lean your body to the left, holding for a few seconds to stretch the entire right side of your body. Return to the center, then lean to the right to stretch your left side. Hold each side for about 5 to 10 seconds, repeating smoothly and naturally, allowing your body to relax with each deep breath. Practicing this exercise regularly throughout the day, especially whenever you have to sit for long periods, will help release accumulated tension in the lower back, while increasing the flexibility and suppleness of your back and abdominal muscles. These muscles act as critical pillars, supporting your spine, protecting it, and distributing forces more effectively during movement, bending, standing, or twisting. Remember, restoring the natural lumbar curve is not a sprint. It is about persistence, body awareness, and daily maintenance. Every time you sit with a straight spine, every time you stretch gently, you are sending powerful signals of recovery to your spine. 3. The golden ritual, every morning and night. As soon as you open your eyes in the morning before rushing out of bed, give yourself a few minutes of quiet connection with your body. While lying comfortably on your back, gently elongate your spine by imagining the crown of your head and your heels being pulled in opposite directions. You do not need to tense up. Simply feel a soft stretch traveling down your spine. At the same time, take a deep breath, letting the air nourish every cell and every vertebra that needs healing. As you breathe deeply and extend your spine, remember an important movement naturally lowering your pelvic area. Visualize your pelvis, which tends to tighten and lift, now relaxing and sinking softly into the bed. This is a very special moment when your muscles are still soft and pliable after sleep, before being stiffened by daily activities, making postural correction and recovery far easier. Repeat this process for about 2 minutes each morning. Gentle stretching, deep breathing, natural pelvic lowering. This is not just a ritual to help you start your day balanced, but also a quiet warm-up to reduce spinal pressure throughout your busy day. Similarly, every night before bed, give yourself these precious 2 minutes. After a long day of sitting, standing, or heavy physical activity, your spine and pelvis have endured constant pressure. Practicing the golden ritual again will release built-up tension, bring the body back into natural balance, and deeply support cell and tissue recovery overnight. It is not expensive therapies or complicated techniques that make the lasting difference. It is small, consistent habits like these that truly transform your health. Because our bodies do not heal from a few explosive efforts, but from simple actions done correctly, consistently, and with genuine understanding. Once you have built proper recovery habits, there is one equally important thing you must never overlook: eliminating bad habits that silently destroy your spine every day. One of the worst habits is sitting with crossed legs or leaning to one side. Many people cross their legs out of comfort, formality, or even unconsciously. However, when you cross your legs, your body weight is no longer evenly distributed across both hips and pelvis. Over time, this imbalance pulls your spine slightly out of alignment, disrupts mechanical balance, and increases abnormal pressure on one side of your back and hip joints. Leaning to one side while sitting has a similar effect, causing uneven tension in the pelvic muscles, leading to chronic lower back pain, spinal misalignment, and even affecting your gait and posture. Equally harmful is the habit of sitting in one position for too long without changing. When you stay seated for hours, your back and abdominal muscles weaken, blood circulation slows down, and continuous pressure builds up on your discs. This is why office workers, long-distance drivers, and elderly people who spend hours watching television often experience lower back pain, numbness in their limbs, or even suffer from herniated discs. Our bodies are designed to move, not stay still. Therefore, every 30 to 45 minutes of sitting, make sure to stand up, walk around, or at least change positions to wake up the muscles supporting your spine. Another often overlooked cause of spinal weakness is sleeping on mattresses or sofas that are too soft and sagging. When you lie on a surface that sinks, your spine can no longer maintain its natural curves and is instead forced into unnatural bends. Over time, this poor sleeping posture compresses vertebrae, dehydrates discs faster, and leads to degeneration, back pain, and morning stiffness. Always choose a mattress with moderate firmness enough to support your body's natural curves, allowing the spine to relax and recover effectively during sleep. Lastly, never underestimate the impact of wearing improper footwear. Shoes that are too high or too stiff alter the natural walking mechanics, placing abnormal pressure on the spine and hip joints. High heels may create temporary beauty, but the long-term cost is often back pain, knee pain, and even lumbar spine degeneration. Shoes that are too hard or poorly fitting also disrupt your walking posture, increasing the risk of spinal misalignment. Spinal health is not just preserved through recovery exercises. It heavily depends on the small daily choices you make. Changing your small habits today is like planting seeds for a future free from pain. Once you have adjusted your daily habits, Another extremely important piece of the puzzle that must not be overlooked is nutrition, because the spine cannot heal itself if the bone and joint cells lack the essential nutrients needed for daily nourishment and regeneration. One of the most critical nutrients for spinal health is omega-3. Omega-3 is a natural anti-inflammatory fatty acid that helps reduce swelling and pain around the vertebrae, supports the recovery of damaged connective tissues and discs, and improves vascular elasticity and circulation. This better blood flow helps the lower back and pelvis receive the nutrients they need to rebuild. You can easily supplement omega-3 through natural and nutritious foods such as salmon, sardines, flax seeds, or walnut oil, all rich and safe sources. In addition to omega-3, vitamin D plays an indispensable role. Vitamin D helps the body absorb calcium more efficiently and maintains strong bone density, a vital foundation for a healthy spine. Many studies have shown that a deficiency in vitamin D not only increases the risk of osteoporosis, but also worsens back pain due to the weakening of spinal structures. Early morning sunlight is the richest natural source of vitamin D. Just 15 to 20 minutes of sun exposure before 9 or 1 a.m., or including more eggs and fatty fish in your daily meals, can significantly support your spinal health. Furthermore, to repair soft tissues, discs and cartilage surrounding the spine, collagen is key. Collagen acts like the glue that keeps connective tissues strong, elastic, and resilient. As we age, the natural collagen levels in our bodies decline, causing joints to become stiffer and more vulnerable to damage. A simple way to replenish natural collagen is by regularly consuming bone broth, especially from well-stewed beef or chicken bones, eating salmon skin, or taking high-quality collagen peptide supplements. Besides focusing on these essential nutrients, one small habit that brings tremendous benefits is drinking warm water in the morning. A glass of warm water upon waking not only activates the circulatory system, boosting blood flow to the spine, but also aids in detoxification and kickstarts your body's natural energy after a long night's rest. There is one factor that many people overlook when trying to heal chronic back pain, and that is mental state. The body and mind are far more closely connected than we often realize. When you are under prolonged stress, cortisol, the stress hormone, surges in your bloodstream. And cortisol does not only affect your sleep or mood, it directly worsens inflammation throughout the body, making your persistent back pain even more stubborn and uncomfortable. A body stuck in fight or flight mode due to stress will not prioritize healing cells. Stop focusing on repairing damage, blood vessels constrict, and the immune system becomes less effective. This explains why even with proper exercise and good nutrition, recovery can still be significantly delayed if your mind remains anxious and stressed. To maintain a positive mental state, you do not need complicated methods. Sometimes just 5 minutes of gentle meditation each day. Deep breathing, sitting still, and tuning into your body's natural rhythm is enough to calm the nervous system and bring the body back into a healing state. Additionally, a simple yet powerful habit is to keep a recovery journal. Each day, jot down even the smallest positive changes. A morning with less stiffness, an afternoon walk longer than the day before. These notes are not only a source of motivation, but also help you visibly track your healing progress steadily and surely. A positive mindset is the most powerful natural medicine to help the body heal itself. When you believe in your journey, when you understand that every small effort matters, your body responds by recovering faster than you ever expected. You see, the journey to healing chronic back pain, even when hospitals have given up, is not a miraculous overnight event. It is the accumulation of small changes, wise choices, and most importantly, unwavering belief in your body's ability to heal itself. Back pain is not your destiny. It is simply your body's way of crying out for help, asking you to listen and care for it properly. And now you have all the tools you need to begin that journey. Do not wait until tomorrow. Do not wait until the pain becomes unbearable. Start today with the smallest actions, because each passing day offers you the chance to renew yourself. If you believe that your body deserves to heal, If you believe in the power of positive change, leave a supportive message under the video such as, "I choose recovery," "I choose freedom of movement." And do not forget to like the video and subscribe to the channel so you will not miss any valuable journeys that will help you live healthier, more proactively, and more joyfully every single day. See you in the next videos, where with each passing day, we move closer to becoming the strongest, healthiest, and most peaceful version of ourselves.